help. And it's okay to talk about it if you need to. One place to get started with information is loveyourmindtoday.org. Loveyourmindtoday.org offers a range of guides, instructions, and insights for dealing with difficult situations or getting through a tough time. If you're struggling with mental health, get the help you need, because most people out here really care. Visit loveyourmindtoday.org. That's loveyourmindtoday.org. Brought to you by the Huntsman Mental Health Institute and the Ad Council.
Welcome to Cape Fear Valley's Making Rounds Live, broadcasting and streaming live from the WIDU Community Room.
The WIDU Radio Network, WAGR in Lumberton, WYDU in Red Springs, and WEWO in Laurinburg.
Making Rounds Live on 99.7 FM, 1600 AM.
We air every second and fourth Tuesday of the month.
Making Rounds Live.
The purpose of this show is to bring you information on health and wellness.
Here's the host of Making Rounds Live, Omega Jones.
And thank you so much, Ray. Happy 2026, and welcome to the very first edition of Cape Fear Valley Health's Making Rounds Live of the year. I'm your host, Omega Jones. Now, as the new year begins, communities are focused on creating a safer, healthier environment for everyone who calls Fayetteville home. And because of some of the topics that we are going to discuss today, I do want you to know that this broadcast is for informational purposes only. This is not a time for you to self-diagnose because, like I said, one of the topics that we're going to talk about today. So if you're suffering from anything that we may discuss, what I want you to do is find yourself a health care professional. Now, ladies and gentlemen, joining us today is Mr. John Jones. No relation, even though we look like it.
Come on now.
But anyway, Mr. Jones is the Community Safety Director with the City of Fayetteville. Now, he's here to talk about the city's approach to addressing community safety. This includes violence prevention. It includes addressing our unhoused population. It also includes expanding mental health resources and connecting people with those resources and investing in our youth. So, ladies and gentlemen, please join me in welcoming to the broadcast Mr. John Jones. Mr. Jones, welcome to Cape Fear Valley Health.
Good morning. Hey, that introduction is crazy. I appreciate that, Miss Omega. I appreciate that.
Now, before we get started, tell everyone a little about yourself and what led you to serve for or within the city of Fayetteville.
Without a doubt. Good morning, Omega. Good morning, and thank you to your team who invited me here, Lindsay, Mr. Thomas, Mr. Paul. My name is John Jones. I have the privilege of serving as the director here for the Office of Community Safety in the great city of Fayetteville, North Carolina, my hometown. So to your question about why this role, why now, the opportunity to create real change is aligned with the momentum here we're building in the city of Fayetteville. There's a lot of new faces in leadership roles across the nation. We're seeing a trend in how municipalities are addressing violence. And in 2024, when the city council and Mayor Pro Tem at the time decided to push forward with this office, I truly believe that they were making a decision to invest into the future generations of community members in the city of Fayetteville. So with that in mind, the Office of Community Safety, our purpose and how I can best explain it to those listening, the Office of Community Safety is in the same category as public safety. We have police, we have fire, and now we have OCS. We are listed under the city manager's office, and our role and our question that we ask ourselves daily as a staff is how are we addressing violence in a more holistic way, in a way that ensures community inclusiveness, in a way that aligns with the humanity piece of community safety, in a way that provides and boosts dignity in individuals, and also in a way that provides sustainable and long-term solutions. And as an office, you explained our 4 pillars, and I'm excited to get a little bit more into those here soon. But we're making some great change in the short time we've been here, and I'm very excited to be with you all today to kind of share a little bit more about what we're doing now and in the future as well.
When it comes to safety, how has working directly in Fayetteville shaped your understanding of residents' needs? Because actually, you said that you are a resident of Fayetteville.
Yes, ma'am.
So you actually knew what was going on
Yes, ma'am.
and what they needed before you stepped into the role.
Yes, ma'am. So, born and raised in Fayetteville, North Carolina. I'm a graduate of Freedom Christian Academy, third graduating class. I have family still here in Fayetteville, North Carolina. I must first shout out my parents who guided me and raised me in the way that led me to this position today. So big shout out to Mary and Joe Jones and my grandfather Elise, proud member of the Gahari tribe. So I bring that up because there's a lot of roots here in Fayetteville, North Carolina. A little bit about my professional background. Prior to coming back home, I was in the city of Chicago where I worked as a youth development coach, also worked within the Department of Public Health, and before I left, within the Mayor's Office of Community Safety. So that experience allowed me to see, one, how are larger cities or more cities in the nation addressing violence through this approach. In the city of Chicago, I got the experience of working on the ground through a not-for-profit perspective. I got the perspective of working within the Department of Public Health, and then working from the policy side with the Mayor's Office of Community Safety. I saw the multi-pronged approach and how everyone can play a role within community safety. So when I come back home, in Chicago, the biggest concern would be gun violence. Big shout out to my former colleagues who are still doing great work, because Chicago just hit the lowest homicide rate for the year in 60 years.
Really?
Which is proof that this method is effective. And this method relies on community. So when I came back home and recognized, okay, what are the needs here in the city of Fayetteville? The gun violence is relevant, but it's not where we're seeing in my previous work experience. However, we do see an uprise in needs for our in-house community. We do see a gap in addressing our behavioral health needs as well. And with the gun violence and with our young people, all four of those were given to me by council, but coming home, I recognize these are the four main pillars that we should be focused on. So, coming down from my own experience, coming here, seeing with my own eyes, but also, and I'll end with this right here, I know I can read data, I can read numbers that say this is what's going on. But if I don't hear from those who live in that area, those who've been here longer than I've been here, those who've been here for the 4 years that I've been gone, a lot has changed in my 4 years I've been gone. So when I came back, I had to ask questions to community folks who have been doing the work prior to the office being here, who have been engaging with our unhoused community prior to me being here. What do you see on the ground? What do you think is effective? What do you think has worked and has not worked? Because we have a chance here in the city of Fayetteville to really change the narrative, one, on the city as itself, but also on how we are taking care of our people. And it's important for me and my staff that we listen to those who have been more invested than we have been, but also those who are on the ground way more than I will be in this city. And with that information, we then determine those next steps for our office.
Ladies and gentlemen, Mr. John Jones is our guest today on Cape Fear Valley Health's Making Rounds Live. He is the Community Safety Director with the City of Fayetteville, and we're talking about creating a safer and healthier environment for everyone who calls Fayetteville home. Now, if you would like to be part of this conversation, there are two ways you can become part of this conversation. First, you can give us a call at WIDU. That telephone number is 910-483-6111. The beautiful Miss Glenda, she's going to answer the phone, and she'll get that question to us. If you want to come on the air, Pastor Paul, he'll put you on the radio. Now, another way that you can do that is if you're following our live stream by way of Cape Fear Valley's Facebook page, what you can do is leave the question in the comment section. Lindsay will make sure, if Lindsay probably doesn't know the answer herself, she'll be able to make sure that we get that question answered for you. And finally, we're also on Cape Fear Valley's YouTube channel. So make sure you share that information and let everyone know what we're doing here in the community. Now, remember our guest today, Mr. John Jones. He is the Community Safety Director with the City of Fayetteville. Now, John, I'm just going to call you. I'm just going to call you John.
You can call me John. You can call me Jay. Whatever you want, Miss Omega.
The Office of Community Safety. I saw, and you mentioned the 4 strategic pillars of community service. I will have specific questions later, but right now, can you kind of break that down for our listeners a bit?
Absolutely. So the 4 pillars that we are focused on as an office have been given to us through City Council. Those 4 pillars are 1, our unhoused community, 2, behavioral health, 3, community violence intervention, and 4, youth programming. So what I will do is kind of break that down, what that means for us as an office, and also highlight some of the steps we've taken to address each pillar. Starting off with behavioral health. How are we as a city addressing the behavioral health needs of our constituents here in Fayetteville? With that in mind, we recognize the behavioral health is not just a blanket where you just throw one resource on. There's gaps where an individual is experiencing a behavioral health concern, and there's a gap in the information sharing of how to get that individual plugged in with the right resource. There's been concerns of how are we responding as a city when individuals are experiencing a mental health crisis. So what does it look like for the city of Fayetteville to coordinate behavioral health resources for those within our community? And what we have done, our brilliant and amazing staff member, Deanna Braggs, who a former colleague of yours.
I'm sorry, I couldn't help myself.
Nah, for sure. Is our rapid response lead, and she is the individual who is going on the ground every day to meet people where they are at. We get calls from community folks. We get calls from the police department. We get calls from council members, et cetera, saying, hey, there's an individual that I'm observing right now, and they are in need of some resources. Deanna then goes out and meets them again where they are and identifies ways to bridge that gap with the need that we see. So she's our rapid response lead. She's done a wonderful job in our 6 months, already responding to 500 plus calls. Wow. So we want to expand that into a model where we have multiple staff members who are addressing these concerns across the whole city. So with that, we are in the process of developing our very own behavioral health response model. This response model mimics what we see in Greensboro, Mecklenburg County, as well as Durham Hearts here in the state of North Carolina. And this model looks like having a clinician respond to an incident or a mental health crisis outside of traditional enforcement. We recognize that law enforcement has a role to play in public safety. We also recognize the roles that they have played historically that are not in their job descriptions. So let's design a team who can address individuals who are clinically and have licenses to address them with their behavioral health background, et cetera. So we are in the process of developing that very own model here in the city of Fayetteville. That model looks like having 911 dispatchers reach out to our staff who will then go out and address the scene. So the steps we've taken thus far have been, we just closed the application period for our behavioral health response program manager. This individual will oversee this process under the Office of Community Safety. We have worked with consultants across the nation, pro bono, might I add, for those listening, through our network who have stood this up in 35 cities across the nation and other partners across the state. Greensboro's director, Letitia McNeil, has been extremely helpful and extended a huge hand and guidance on how they built their model so that we as an office and as a city are addressing the needs in the most effective and humanely way, if that's a correct word. So that's one. Second is our unhoused community. Same with Deanna's role, but also the coordination of resources here in the city of Fayetteville regarding our unhoused community. We recognize the huge lift the Fayetteville Cares, formerly known as the Day Resource Center, has provided to our unhoused community. We recognize that to address the unhoused needs in the city of Fayetteville, it's a multi-pronged approach. We understand the role the county has in this. We understand the role that our sister department, the economic and community development, have a role in working on our unhoused community. The gap was who are meeting these people in that time. When there is someone who is in a situation and they have children and they're looking for a place to stay, who from the city's perspective is going to those individuals to meet them, coordinate the right resource, make those calls to ensure that that person's needs are being met. That's where we as an office, and that's our approach with the unhoused pillar. As the weather has gotten cold recently, we recognize the need to have more staff readily available to address that, which is why we're kind of pushing this behavioral health response model out, because this will be a part of their job description as well. Thirdly is our youth programming. So youth programming is a topic that gets a lot of attention in all cities, not just City of Fayetteville. What are we doing for our young people? The beautiful thing about City of Fayetteville is there are multiple community partners who are investing in our young people on a daily basis, all across the city. So when I stepped in, I recognized, okay, there's already work being done. How do we ensure it's as effective as possible? So with that, I always preach three things: coordination, collaboration, and communication. Three things that often get preached a lot, but are rarely followed through with. But now the City of Fayetteville has an entity who can be the convener and coordinator within our office, so that we can disseminate information, plug in gaps. And if a young person is in need of something, we have multiple organizations who can step in that we've worked with. And now my mindset is, how do we ensure that these programs that are functioning and are being effective can expand over time? So that looks like working with our ECD department, who is working on capacity building workshops to ensure organizations can scale up. That looks like working with other organizations, identify potential funding sources. It looks like for us activating safe spaces through our community partners. We had one recently at the community center on Country Club. We had 134 young people pull up to that church, and from 6 to 9:30 p.m. just had a safe space that was purely activated. And that was in partnership with community partners who were able to bring these young people out. We wouldn't have had 134 young people if it wasn't for the community partners who knew these individuals, who knew these young folk, who also knew the needs of these young folk, so that when we coordinate resources, we want people to have fun and get a little sweat on for sure, but we also recognize that some kids, they just may need a room to sit in and be quiet. So we had a sensory room. We've had other youth night outs where we had individuals who were young people who were looking to expand and begin their professional careers. So we had resume building and work and headshots through a community partner, Ms. Z, mentoring. So when we have these activations, how can we pair that with potential resources to ensure the effectiveness is as high as possible? And we also have some really unique and dope ideas for our young people coming out this year that I'll just wait on, but be on the lookout, because we really want to be intentional with our young people, especially the young people who the systems have given up over the years. And how do we support them? Because if we really want to see a change in violent crime, and we want to boost the future for our young people, that means we need to reach out a hand and restore those relationships. And we as a government office recognize the need for that. And the last thing I'll say is our community violence intervention pillar. This is where I bring in the most experience, because this is what I've seen in Chicago, and I've seen how this has succeeded more than anyone could imagine. Chicago doesn't have 8 years of steady decline in homicides and violence if it wasn't for community violence intervention. So I'll break that down a little bit, because the ecosystem here in the city of Fayetteville is on a novice basis, but we're looking to expand that, if I'm being transparent. So what does that look like? That's utilizing a community partner, a trusted messenger, a mentor, someone in the community who can tell someone, hey, I know you're about to do this, but let's not. I can't do it because I lived over there in Westover by Devonwood. But I can't come on the other side of the city and tell someone who I don't know, hey, you need to stop, because they don't know me. I'm not a trusted messenger. Who am I to tell you what to do? So how do we actually build an ecosystem where we have community folks who are legends in the area, who have incredible influence, and who can be a person of change, to where if someone would listen to them, they would let me take a step back. Let me de-escalate. And how as an office do we support the that becoming a professional model here in the city of Fayetteville. There are cities across the nation who have CVI workers, street outreach workers, who are now part of the first responder model. Because when something happens in the neighborhood, everyone who lives in the neighborhood knows what's going on. And how do we ensure that they're part of the conversations when it comes to developing solutions? And the CVI model is something that I'm excited to really build upon in the city of Fayetteville. We have a good foundation, and we're looking forward to expand on that. Literally starting next week, we have some unique opportunities for specific individuals to learn and train from those across the nation. But that's the quick. My background, I grew up Pentecostal holiness, so if I need to stop talking, Lindsay, just let me know. But those are the 4 pillars in the brief description, and how we as an office are moving forward with those 4 pillars.
All right, well, Pentecostal holiness, I know we can get church going up in here. But ladies and gentlemen, we have Mr. John Jones with us today on Cape Fear Valley Health's Making Rounds Live. He is the Community Safety Director with the City of Fayetteville, and we're talking about creating a safer, healthier environment for our community. And when we return, we're going to ask Mr. Jones what community safety looks like across Fayetteville. Cape Fear Valley Health's Making Rounds Live. Make sure you stay close.
We'll be right back with more of Making Rounds Live.
Cape Fear Valley's Making Rounds Live.
Broadcasting and streaming live from the WIDU Community Room on 99.7 FM, 1600 AM.
The WIDU Radio Network.
This is Pastor T.C. Lee, Smith Temple Church of God in Christ. You are listening to Wake Up.
Federal Reserve Chair Jerome Powell says the Department of Justice has served the central bank with subpoenas and threatened it with a criminal indictment over his testimony about the Fed's building renovations. State lawmakers are expecting updates today on major new changes from the federal government that could affect millions of North Carolinians. Absentee ballots for the March primary are being mailed out. According to the North Carolina State Board of Elections, voter turnout in 2022 was the highest for a midterm primary in 20 years. CBS News correspondent Bradley Blackburn says that President Trump and his national security team will focus today on spreading unrest across Iran. Governor Josh Stein visited Saluda residents struggling to repair damage from Helene to their homes. As of Monday, you now have just 20 days to get a real ID before Raleigh-Durham International Airport starts fining travelers without one. Mike Rayleigh, NCN News.
I'm Jamie Monticelli, WIDU Radio News. City Manager Doug Hewitt invites you to Doug in the District. This is Tuesday, January 20th, 8 a.m. until 10 a.m. at the Coffee Scene at 3818 Morganton Road. Your input matters, and the city manager wants to hear directly from you. These conversations help shape decisions, strengthen connections, and ensure that our community grows in ways that reflect the needs and priorities of its residents. Residents are invited to attend whenever they are able during the event. On January 9th, FPD teamed up with the Phoenix Center, Goodwill, Code Enforcement, Rapid, the Office of Community Safety, ALE, and the Fayetteville Fire Department to address community concerns along the Murchison Road and Jasper Street corridor. The collaborative effort focused on city code violations, narcotics activity, illegal gambling, and other quality of life issues. The Fayetteville Fire Department also engaged with residents by providing fire suppression systems. From WIDU Radio, I'm Jamie Monticelli.
It's a cold start to our morning here on this Tuesday. Temperatures in the 20s for the most part. Mostly sunny heading into the afternoon with temperatures reaching 55 to 60 degrees. Partly cloudy overnight, not quite as cold. Temperatures dropping into the 30s. We'll see highs in the low to mid 50s Wednesday afternoon. It's a mostly cloudy sky and the chance for a stray shower after about 3 p.m. moving to the east. For the North Carolina News Network, I'm meteorologist Chris Michaels in the Weather Center.
Wake up, catch the vision, join the team. This is Pastor Reginald Johnston of My Father's House Christian Church right here in Fayetteville. We want you to wake up and join the team. Behold, how good and pleasant it is for brethren to dwell together in unity. It's good when we come together. We're one body, many parts. We desire that you wake up and join the team. It's good to be a part of Wake Up. Wake up, join the team. We will see you in Jesus' name. God bless you.
Hi, this is Apostle Bernard L. Whitfield, Jr. of Righteous God Ministries, 348 Old Wilmington Road, 910-220-5228. 223-7591. The pastor is Phyllis Vernell Whitfield. Our service time is 9:45 Bible study, 11 a.m. service. Tuesday night Bible study begins at 6:45. And remember, come as you are. You don't have to clean up to get up, but come see us, and we'll be there for you. God bless you. Heaven smile upon you.
This is Glenn Goldsmith from B&E Services at 2557 Ravenhill Road, Suite 1B in Fayetteville, North Carolina. You're listening to Wake.
This is Bishop Johnny Ray Jr. of the Churches of Worship Worldwide, Apostle J. A. McDonough, 2118 Owen Drive. And we are proud to be a part of the Wake Up. Come and join the team.
We now return to Making Rounds Live.
Cape Fear Valley's Making Rounds Live.
Broadcasting and streaming live on the WIDU network, 99.7 FM, 1600 AM. Here's Omega Jones.
That's right. Welcome back to the second segment of Cape Fear Valley Health's Making Rounds Live. Today in the studio we have Mr. John Jones. We are talking community safety. We're talking mental health. We're talking connecting resources with people who need those resources in the community. And oh, by the way, Mr. Jones, he is the community safety director here in the city of Fayetteville, also a Fayetteville native who went to Chicago. But anyway, let's get back to the interview. So, John, before we went into break, from your perspective, what does community safety look like across Fayetteville?
Community safety across the city of Fayetteville looks like individuals in their areas of the city, one, having pride in what they see when they step outside of their front door. It looks like resources, basic needs for humanity are being met. It looks like individuals across the across the city are experiencing a higher quality of life. And so, of course, I'm dreaming, needs being met, everyone getting fed, housed, all those pieces together with the foundation of people coming together, a community leading this. Instead of thinking of enforcement and punitive justice, we're looking at restorative justice. We're looking at families who are able to come back together and work on the area that they grew up in. We're looking at feuds that have been going on for years and years to have an approach where we can bring individuals who are trusted messengers but may have caused division in this city to come together, sit down, and create unity. When I think about community safety, it touches everything in the city of Fayetteville. It touches traffic, it touches community environment, it touches public health, it touches young people. All of these factors, just like public health, I believe everything in the city and anywhere touches community safety. Because if you are to do something well and with the heart that is looking to really solve a concern or an issue, then over time you will see effectiveness in that. So across the city, it looks like people coming to events and not worrying about something happening. It looks like activations in areas of the city where people have maybe some concerns on. And we'll get into that a little bit later too. It just looks like joy and kids laughing, people's needs being met, and also community coming together for community. And it's unique to think about how can a government office be the one to say this and see a vision where that could be possible, which is why it's important this office is community led. Because if it is ran by just government officials or is influenced by government officials, then we're going to see a cycle. And I didn't come down from Shad to be a part of a cycle. My goal is to do this work so well that we're thinking about how to be innovative with even the approach we have and how to go in other cities across the state and see how this can be effective in your community area as well. So long-winded response, but that's what I see. Like, I think about kids laughing. I think about events happening, people feeling safe, people letting their guard down. And then again, we are meeting people where they're at and addressing the needs of our brothers and sisters.
You mentioned people letting their guard down.
Yes, ma'am.
And you mentioned events.
Yes, ma'am.
Here in Fayetteville, you already know.
Mm-hmm.
But I see that you have some late night events planned for the youth.
Mm-hmm.
Tell us about that.
So we've had multiple late night youth events. Huge shout out to my staff, Nichelle Gaines, our program manager, Najeri Fikes, our community engagement lead, who have worked tirelessly with community partners on ensuring that we are activating these spaces. And what I want people to see when we have more of these is that you can have youth together. You can have them in the same space and nothing come out of it except for positivity. Because what I tell my team is our goal when we have an event is that everyone has fun and goes home safely.
Exactly.
So we also have to consider one thing about Chicago that we're looking to implement here in the city of Fayetteville, and we're already having behind the scenes conversations with specific community partners, is what does that look like also for our adult crowd? In Chicago, one of the most unique things I've been a part of was launching late night basketball, which back in the day they had an official term called midnight basketball. But late night basketball in Chicago, in two of the hottest neighborhoods in the city, on one of the hottest weekends, Memorial Weekend, which historically we saw spikes of shootings in those times. We activated 2 gyms on specific intersections from 10 p.m. to 1 a.m. and had a bunch of individuals come in and they played basketball. We also had some resources there available. We were able to coordinate with Lyft to ensure that people were able to travel there without any concerns. And we left at 1 a.m. Everybody was gone. Everybody went home. And in that one night, nothing happened in that radius of the area that we served, which historically was not the case. Wow. So when we think about activating these safe spaces, we're really thinking about how do we create safe spaces, even if they're historically not seen as safe spaces. How do we activate that so that we can change that narrative? And we recognize the unfortunate incidences that occurred when people did not feel safe, and things happen. I do not disregard that. How we change that, though, is we continue to show you can have a safe space. You can have an event. And the more we activate, the more examples we'll see. Like, nah, that was a one time, but we had 27, just throwing a number out there, where nothing happened. And our goal as Office of Community Safety is we want to activate safe spaces from every weekend from April to the end of August. We're actually working on some paper right now to ensure that we put dollars in the hands of community to be the ones to lead these activations, and we as an office should support in some of the coordination of the resources. Because again, community partners know more than I do about their particular area. So you know what your community needs. Your community may need a bunch of resources regarding diapers and behavioral health. While this area, hey, they got that, but they need jobs. So how do we coordinate those resources that you as a community partner can activate that space, meet the needs of the people, but also show like, hey, you can come outside. You can have fun. And nothing happened from this. And the more we do that, one thing about the mayor, city manager, and council right now is they want to really, how do we change the narrative of the city of Fayetteville? And having this approach will play a significant role in that, I truly believe. But it takes all of us. It takes trust, too. You know, that one event may have 4 folk. I recognize that because then the more I do this, then you'll see and you'll come out. And we'll work with our partners at PD and fire and other entities to ensure that there is safety measures in place. But again, it takes a whole effort and it takes time too. I don't expect people to believe, oh, OCS is having one event or they had a few events this year, everything's good. No. Like, let me earn your trust. Yeah. Let us show you this is effective. And if you have questions, let's talk about it. Because there may be some concerns there that you may have that we can get a resource for you so you can overcome that. And that's where we're at. And that's one of the biggest things that we're pushing here, especially in 2026.
Ladies and gentlemen, the Community Safety Director with the City of Fayetteville, our in-studio guest today. His name is Mr. John Jones, and we're discussing how the city is creating a safer, healthier environment for the place we call home. Now, once again, if you want to join in on the conversation, you still have a few minutes to call in. Don't wait. Telephone number 910-483-6111, or if you're following us by way of Cape Fear Valley's Facebook page or YouTube channel, you can leave the question in the comment section of the Facebook page broadcast, and we'll make sure that we get those questions answered for you. Finally, one other thing I forgot to tell you, make sure you share the broadcast. Very important information going on right now. We need a lot of community involvement. We know that we only scratched the surface with the broadcast. So help us spread the word as far as what they're doing in the community, what the city of Fayetteville is doing, and how you can become involved. Now, John, one thing you were talking about, one thing that being in media, we tend to lead by if it bleeds, it leads. So, yeah, those few instances, they're always going to get the news versus the 50 that you do that help the community. But you guys are creating a safe space, and that is what this community needs, is a safe space. So stay focused and keep doing what you're doing.
Yes, ma'am.
Now, let's talk about trust and communication, because you mentioned that quite a few times.
Yep.
It's essential between residents and public safety leaders. How is the Office of Community Safety working to build that trust in the community?
Trust is essential for us as an office to, it's essential for us to move forward. I also recognize in my own experience in Chicago and here in Fayetteville, as a government employee, that I may come in a conversation at a deficit because of what the system has done historically to the individual I'm meeting with. I recognize that. I think it's important for me to vocalize that as well. So when I came into office, my mindset goes to, how do we come in with a listening approach? So that means my staff and I need to be very intentional on going to community meetings, not talking, this is what we're trying to do, but my name is John. I serve as Director of Office of Community Safety. I'm here to listen. I'm here to also speak if you would like me to. One thing about my team that I'm very proud of, because we have a team of 4. We just had we had a team of 5, but huge shout out to Orlando Smith, who retired on us.
Oh, okay.
He's a great grandfather now, so huge shout out to him, sir. But it was important for us to be outside, go to where the community is at, and just sit. So I'm proud to say, I believe, and since our first 6 months, we over 125 community engagements that we've just supported by just going and listening, not even tracking the numbers and the individuals that we may encounter on a daily basis. But another thing too, kind of going back to the transparency, especially because all of our budget right now is corporate funds. So the taxpayers are paying for this office. Our budget is $2.4 million. I've heard a few numbers, so I just want to make sure that's clear. But when we've gone in front of council to do our quarterly reports, very similar to PD, similar to fire. I also believe it's important that we do a quarterly meeting in front of community. So not just in front of council, but we had one already where we went to the Bill Chris Senior Center. We presented the same presentation and ended with a community feedback conversation. That is the standard and will be the model that we continue to follow as long as I'm in this position. Because one, community may ask the questions that they can't ask at council because of the access. They may pull me aside, hey, Director Jones, you said this, I want to know a little bit more, or why that? And it's important for us to, not everybody goes to council sessions. Not everybody even listens to council sessions. So, but if Omega says pull up to Seabrook, we're having a OCS quarterly meeting, then more people may come because of your influence. So how do we coordinate that, disseminate information through community partners to ensure we have presence in our community-facing meetings? That is the most important thing for me, because I want the community to hear, in our first 3 months, we've done this. In second quarter, we've done this. We're in the process of scheduling when the next one will be. So I'll make sure to share that information with you all. But the first one was a success. We had probably over 45 people in attendance. Wow. And introduced OCS, shared what we're working on, and then as we move forward, we'll have more intentional conversations about the results that we've been able to do. Because I know a lot of people say we're a new office, and technically we are, but I want to get out the mindset as a leader to say, okay, we're moving though. Yeah. And it's important that when we go in front of the community, we have information that is stored so that we can share that with them. We can share, we've spent this amount of dollars in this quarter on these particular areas. We've spent this amount of time in these particular areas. I've traveled to these particular locations, so that there is no question of what is OCS doing with the dollars that we are providing through taxpayers dollars. And that's important for me. And the one thing about building trust is, if I tell you I'm great, everything's going well, I'm chilling, life's great, perfect, then you may be like, But if I tell you the stuff that you may not want to hear, or the stuff that you may not be expecting to hear, like, oh yeah, we spent this much already, and here's how it broke down. I didn't meet that person. I made a mistake. I followed back. There was an individual, and I'll be very transparent. There was an individual who reached out to me. I did not respond because I didn't see it. I told him I was going to call him back. I forgot. I saw him at a meeting, and I addressed my concern. Person was upset, rightfully so. But for me, it was recognizing with her, hey, I made a mistake, and I'm willing to do what I need to do to fix it. And we talked about it. And now we're good, hopefully, But going in front of the community, sharing the information that they may not have historically received, which is the beauty of having an office that is brand new. I'm not going back to what we did last year. I have the ability to build a foundation, and I want that foundation to ensure that trust, communication, collaboration, coordination, and other pieces are involved in that. And it's my job as the leader of this office to be the one to ensure that is happening. And I can proudly say that we're doing a good job. We could always improve, but we're doing a good job on that. And people have reciprocated that with us and shared their delight to see some transparency within our office, because there have been a lot of questions too.
You were talking about the community feedback sessions.
Yes.
And you were talking about how successful the first one was. Are you going to have more of those?
So the community feedback session, so the quarterly meeting we had at Bill Crisp, we had 2 round circles to discuss pillars. The goal of that was to have my staff who oversee the pillars to be in those circles and discuss their perspective on what we're doing as an office, but also answer any questions. What we are doing, and I'm just going to transition over to the community feedback sessions, if I may. We are working with the National Institute for Criminal Justice Reform, also the National Office of Violence Prevention Network. They're a consultant that has helped us along this first year. They're supporting us in developing our office's very first strategic plan. In this plan, we're going to highlight some of the work that we want to see, the timelines. It keeps us accountable as an office. It keeps us accountable as a city. But I would ensure that we can call this the People's Plan. But for us to call it the People's Plan, I need to have the input from the people. So we are having community feedback sessions Tuesday and Wednesday. Most of them are at the Kiwanis Rec Center. We're having them in various time frames, 9 to 11, 12 to 2, 3 to 5, 6 to 8, Tuesday and Wednesday. So we know people got work schedules, et cetera. And the goal is with Nick Jr. to go over some of the work and some of the drafts that we have as an office regarding the strategic plan, and then hear from community, what do you want to see in this? And then Nick Jr. is having their staff note take and facilitate those conversations so that we can be as informed as possible. Because if I'm just here doing John's plan, then it's going to burn. And 2, it's not going to produce the results that we want to see as an office. City Manager Hewitt didn't bring me to build John's plan. But that also means as an office, we need to have listening ears. Again, the foundation of this department. And And those are happening on Tuesday and Wednesday. And the one thing I want to ensure that we say is that we are also the second day, the 21st, the 6 to 8 session is only open to young people. Oh. I know there's a lot of conversations about young people.
Yeah.
And the gap has always been young people haven't been at the table. So we wanted to do right by them and provide a space where they are the only ones in attendance. Now, if you're a parent, you can drop them off. We can discuss what that looks like. But that 6 to 8 session on the 21st is specifically only for young people, as we look to hear from them directly about what they want to see in this plan. And it could incorporate some of the work within the 4 pillars, but it could be something different too. We want to hear it.
Well, Mr. Jones, before we let you go, because I see Paul just came in, so that means my time is limited. I've been watching you for the past hour, and I saw passion. I see passion. What makes you so passionate about what you do? And what gives you hope about the future of safety in Fayetteville and the community?
Sure. What makes me passionate? That's a good. I haven't been asked that question. Wow, you got me, Omega. Okay, I'm just gonna keep it 100. Oh, excuse me. I'm gonna keep it transparent.
You gonna keep it 100.
There's a few things about me in my journey of where I'm at. One, I think the Creator put a desire to serve people in my bloodline. My father is the definition of that. I'm getting my mom, they just, growing up, they serve people well. They're the definition of taking my shirt off my back to help you. Mm-hmm. So that's dope to have parents like that, and also leaders in my life who have given me grace in areas where I've made mistakes, who have met me where I'm at. Also, a little, for those triggered by this, personal experiences, I'm a cancer survivor. A lot of people don't know that about me. But in 2016, I got diagnosed with medulloblastoma, a pediatric brain cancer. I was 19. And some of the best moments of my entire life were actually in that season. And there was a joy that I encountered in that time where, and it was all because people were serving me in that time. People came to check in on me. Mm-hmm. And when that season ended, and praise be that I'm here today, I knew for the rest of my life, there is something that I can do to ensure that people who encounter me, my hope is that they feel a sense of I can relax and feel a little bit of joy, or at least feel seen. Now I'm human and I'm not perfect in that space. I've made a lot of mistakes. We'll continue to make mistakes. But I remember in my own life when people have provided dignity for me, who acknowledge me for who I am, and who are willing to stick their arm out. Without them, I wouldn't be here. So for me, the passion really comes in serving people in a way where you may feel seen in that one moment. And if that's it, then praise be that you have experienced that. But now as an office, we have the responsibility, I say, and the opportunity to develop a strategy and to develop a new approach where that simple act of servanthood, which is what I'm called to do, which is what my staff is called to do, all city employees are called to do, to ensure that act of servanthood is the baseline for everything that we do as an office. Because if we are not here to serve people well, then what we're doing is causing harm. Yeah. And there's nothing that gets me more than a success story where someone started off by just being introduced and, man, you made me feel seen or heard. And how do we scale that to be something where it's like a norm when it comes to our unhoused individuals? How do we acknowledge them in a way or make it the standard to acknowledge them in a way where we see people first. When it comes to our young people, no matter if they're the ones who are creating or stirring up things or not, or they're the valedictorian, how do we see them as the same? How do we see them as a young person who's trying to be a kid? And how do we address those gaps to ensure that they have the opportunity to be a kid? Same with those individuals who have experienced amounts of trauma and are now living through that and have no idea that that's what's going on, or that's the source of what's going on in their behavior. How do we address them and meet them where they're at? When I come to work every day and my staff comes to work, they push me, because they're just like this, my whole team, to serve people well. And that's what drives my passion, I guess you could say. Because again, nobody's actually ever asked me this question. That's what drives me when I come into work every day. And when it comes to community safety, and I'll wrap it up here, is that we have a chance to scale this to let it become the norm. We're not just throwing handcuffs on folks, though there is a need for that. And I will say Chief Brian has been an incredible partner in this work, an incredible partner. And he also recognizes that we don't want to just throw handcuffs on folks. The kid who's stealing food from the store, that he's stealing on surface. But we know there's layers. That kid may be trying to eat. And the same with the individual who's robbing to make money. They may not can find a job because of something that happened 20 years ago. It's not the service level doesn't show people's true hearts in most cases. And let's figure out the underneath pieces so that we can ensure a higher quality of life, and that we as an office and as a city of Fayetteville are playing a role in leading that way for this part of the state, but also, again, that example of how we think of people when we do everything we do. And if we start with that, then I'm very optimistic that we'll see results that benefit the longevity and the quality of life for our community residents.
On that note, ladies and gentlemen, Mr. John Jones, keep up the amazing work.
Thank you.
God called you back here for a reason. And I'll put that on out there and just go ahead and say he is the community safety director for the city of Fayetteville. And if they want to reach out to you, how do they reach out to you in your office?
You can reach us at Nichelle, my program manager.
All right, well, I have it here. I have it
it's
right here.
FayettevilleNC.gov/OCS is our website. And then we have OCS at FayettevilleNC.gov is our website. But if you check out our website, one, you can, the links to register for the feedback sessions is on our website. Also, a huge shout out to Lauren and the Marcom team. They're extremely helpful with posting information about the Office of Community Safety. So please follow us on the Fayetteville NC government pages on all social media platforms. And then all of our contact information as an office is on our website as well. And you can, my staff's individual emails are on there as well.
All right.
Yes, ma'am.
Well, ladies and gentlemen, Mr. John Jones with us today on Cape Fear Valley Health's Making Rounds Live. Our next broadcast is Tuesday, January 27th. And speaking of Cape Fear Valley Health, we will have a conversation with the CEO of the health system, Mr. Mike Nagowski. So make sure you join us. For our executive producers, Shaka Jordan, Ray Thomas, and Lindsey Graham, and the hardworking team behind the scenes, I'm Omega Jones, continuing the Darvin Jones legacy. Thank you so much for listening to and watching Cape Fear Valley Health's Making Rounds Live. We'll see you next time.
Thank you.
WIDU 16.